What is Ebola? Ebola, a virus disease formerly known as Ebola hemorrhagic fever, is a severe, often fatal illness in humans. Ebola outbreaks have a case fatality rate up to 90%. Ebola outbreaks occur primarily in villages in Central and West Africa. Transmission. The virus is transmitted to people from wild animals and spreads in the human population through human-to-human transmissions. Fruit bats are considered to be the natural host.
Recently there's been an outbreak of Ebola in Guinea. The disease made a leap from remote forested areas of the country to the capital, causing widespread fear. At the time of writing there were 127 confirmed cases, 87 of whom had died. There are further cases outside Guinea in the neighbouring countries of Sierra Leone and Liberia. It's been described as an epidemic on a scale never seen before. But what the hell is it? The Ebola virus causes Ebola virus disease, or EVD. It's one of the most virulent diseases known to mankind. Ebola is actually a group of 5 viruses: Bundibugyo Ebola virus, Zaire, Reston, Sudan and Thai forest. The outbreak in Guinea is one of the most deadly forms, the Zaire strain. The Zaire strain can have a fatality rate of up to 90%. Ebola was first identified in 1976, with 2 outbreaks that happened at pretty much the same time. One was in Sudan and the other was in the Democratic Republic of Congo. The DRC outbreak happened near the Ebola River, which is where the disease gets its name. And the most deadly outbreak ever was also in DRC in 1995. That killed 254 people out of a total of 315 infected. That's an 81% mortality rate. Ebola is found in fruit bats, chimpanzees, gorillas, monkeys, forest antelope and porcupines, and it passes to humans through close contact with bodily fluids, blood and the organs of those infected mammals. So one of the main ways that it's introduced to humans is by eating bushmeat, the meat of dead or already ill animals. It's then passed from human to human by direct contact with blood, secretions, organs and bodily fluid, through broken skin or mucous membranes. If a man is lucky enough to survive Ebola, he can still transmit the disease for up to 7 weeks afterwards through his semen. That's why the government in Guinea has warned people against having sex, kissing or even shaking hands at the moment. It can also be passed on via a dead body if mourners have contact with the deceased person. Healthcare workers are at particular risk because of their close contact with patients, and that's why the World Health Organization has sent 3.5 tons of protective materials out to Guinea, which includes biohazard suits, disinfectants and burial shrouds. Ebola first manifests itself with a sudden fever, weakness, muscular pains, headaches and sore throats. But that quickly worsens, with symptoms including vomiting, diarrhea, rash and impairment of kidney and liver function. In some cases, internal and external bleeding also occurs. It has an incubation period, that's the time between infection to the onset of symptoms, of just 2 to 21 days.
The Ebola virus is characterized by fever, intense weakness, muscle pain, headache, and sore throat, followed by vomiting, diarrhea, rash, impaired kidney, and internal and external bleeding. There is not a treatment or vaccine available.
In western Kasai, in the heart of the Democratic Republic of Congo, 7 people have contracted Ebola hemorrhagic fever. 39 others are showing symptoms of the virus. The results are due back from the laboratory confirming whether or not they are infected. In the meantime, 13 of them have already died.
The first symptoms of Ebola are difficult to distinguish from other infectious diseases or even chronic diseases. Patients present with fever, they present with general signs of weakness, of vomiting, of muscle pains. Later on in the disease, when you have an inflammatory response, you start to develop what we call hemorrhagic signs. You can develop hemorrhagic sign, which means that you start bleeding from various parts of your body. This is in the late phase.
The virus is fatal in 50 to 90% of cases. To improve the chances of recovery, the medical teams rehydrate their patients, provide them with psychological care, and try to relieve their suffering. The patients are isolated, as the disease is highly contagious. It's transmitted through blood, feces, and vomiting. An isolation center has been set up, like this one used last year.
An Ebola patient will mainly contaminate the person caring or treating him through his liquids. That means his vomit, diarrhea, tears and sweat. And if the patient is breastfeeding, she can even contaminate her child through her milk. Another way is through the tiny drops of saliva that a patient spits out in front of him. So we have to take precautions to avoid all contact with the patient's liquids. Avoid the virus getting in through the eyes, the nose or the mouth, which explains some of the equipment we have to put on before going near the patients.
Certain steps must be taken to contain the epidemic. Teams make daily visits to the homes of any person who has had contact with the virus. They check them for symptoms and disinfect their homes. It is also essential to circulate information on the disease and how it is transmitted.
Prevention. Prevention efforts focus on avoiding contact with the virus. The use of infection control measures, including complete sterilization of equipment, the isolation of patients with Ebola hemorrhagic fever from contact with unprotected people.